question, please. Thanks.
Yeah, I'm John. I work in general practice at the minute. I worked in a sort of organisation with multiple practices and was involved in training all the juniors that came along into the other practices. One of the biggest problems that we had was not the sort of knowledge of the pharmacists themselves, but the knowledge of the GPs and the managers in terms of what the pharmacists could actually do. So with this scheme, is anyone educating the management of the practices and letting them know what these pharmacists are knowing, if that makes sense?
So it's a really good point, and I think that's where the OD support package started. We're hoping that some of the guides that are coming out from, like the one that PCPA are launching around what to think about when employing a clinical pharmacist would be helpful.
It goes right down to GPs not knowing that a pharmacist has 5 years training. They have absolutely no idea. Short of having quite a lot of initiative and going about it yourself, you could teach a pharmacist as much as you want. But unless they've got the initiative to put that into the practice themselves, it won't work.
Yeah.
You need the practice partners to lead it.
Yeah, so the idea of the OD programme that we would like to have delivered in the practices, and I can talk about where we're at with developing that, a little bit like Chris. We're still looking at the development of that, but I see that as sort of 4 strands. So strand 1 would be some resources such as the guide. RPS are doing some guides as well, so some online resources that are very practical, things that you need to know and things that you will need to do. The second strand of the development support would be virtual learning environment, or I don't know, Blackboard's a trade name, isn't it? But that sort of, I'm thinking of employing it, or I'm now employing a clinical pharmacist as a GP. Is anybody else doing it? What are they doing? I'm a clinical pharmacist working in general practice. Is anybody else out there doing it? So it's about connecting and supporting that connectivity. The third element then would be some web-based learning. So things like what does a pharmacist do? What can a pharmacist do? What is the sort of training that they have? How do I make my practice ready for change? How do I integrate a new person? And what we anticipate on there, there'll be some very academic stuff, but there'll also be some very practical, pragmatic, hands-on stuff as well. And then we're suggesting that based on a diagnostic that would be online, practices would be able to say, actually, we don't know anything about a pharmacist, so we want somebody who's a pharmacist to come in and tell us what our pharmacist can do. Or you might have the other end, which is, well, we've already got 2 clinical pharmacists working with us, but our proposal is to have 17 more working across the whole geography, and can somebody work with us on some change management or business process re-engineering? So we want people to be able to pull in exactly the type of resource they need. But what I would like to say is, if you've got lots of examples of what GPs don't know, or what you wish your practices had known beforehand, please tell us. We will gather some of that and we will help put it into some of the guides. We might pick your brains a lot, you know. We want to learn from you. I'm not an expert in this. I'm a program lead, you know. I'm not a pharmacist and I'm not a GP. I have helped develop this program by working with a lot of partners, and there are more partners to work with. So if you think that you have some specific thoughts about what needs to go in that, what GP practices need to know, please tell us. Email me on the inquiries number or grab me at the end. So, yeah.
I think that's why also we realise the leadership part is so important to that individual. The pharmacist just can't wait. They've got to take the control of this. So that's why we kind of thought to bring that up right up front would be a key part. The other part we expect to do around the development programme, and we need your help with this as well, is almost instead of using best practice, it's almost, and it's not even clinical excellence, it's almost stretching those clinical responsibilities that pharmacists may be able to do in the short term, medium term, long term, and actually keep challenging them. Are you doing this now? Are you doing that now? Are you telling your practice you can do this now? So actually taking that attitude of actually, I can do this now, so I should be doing this for you.